Hey everyone, thanks for joining me. Today I'm having a conversation about why we see irritable bowel syndrome more often in women over the age of 40. So if you are over the age of 40 and you've always had a history of digestive upset, then you would certainly fall into this category. That's the person who maybe always had a sensitive stomach, but then after the age of 40, you really start to see those challenges accelerating. Or maybe you're somebody who used to have strong digestion, but now you're starting to notice symptoms that you didn't have when you were younger. One of the main reasons why we see people having digestive challenges over the age of 40 is simply due to the process of aging. As we age, pancreatic function may decline. This is especially true if we are doing a couple of things that may be aggravating pancreatic function. Number one, eating too quickly. If you are not slowing down and chewing your food, that can certainly cause digestive upset. Particularly, this can become a problem as we get older because our digestive system is getting older and it's making it more difficult to process our food. So you really want to slow down and chew your food. If you're eating quickly like a young child, you may find as you get older that doesn't really work for us the way it used to. A second reason why you might be having digestive upset is if you're eating more calories than you can digest in any one sitting. And again, this is aggravated by aging because as we age, pancreatic function may decline. Now, what is the pancreas? The pancreas is an organ that sits on the left side of our upper left quadrant of our abdomen, and it helps producing enzymes that break down and digest food. We also have enzymes in our saliva. If we have dry mouth due to medications like diuretics, if we have dry mouth due to stress, if we have poor pancreatic function because we're simply getting older, then large meals are going to be harder to digest than smaller meals. So the solution may be as simple as slowing down chewing your food and having the meals be smaller. Now, I've been asked if eating and drinking at the same time is going to have an effect on digestion. Should you abstain from drinking even something as benign as water during your meal, or can that cause gastric upset as well? I'm on the fence about it. I think a little bit of water is okay, but if you're drinking massive amounts of water when you're eating, yes, I think theoretically it might have an effect on digestion. So another couple of things that you may want to try if you've slowed down, chewed your food, you're having smaller meals, and you're trying not to stress out. If you've talked to your doctor about any side effects of medications that are causing dry mouth, you've taken care of all of that, and you're still having irritable bowel syndrome-like symptoms, you might want to talk to your doctor about a couple of different tests. The first test I would recommend is an H. pylori breath test, and that's a test to see if you test positive for H. pylori, which is the bacteria that's now being associated with stomach ulcers. You can do a breath test, but we also do blood tests checking for antibodies. Another test you might want to do is a lactulose breath test, and that's to test for something called SIBO, Small Intestinal Bacterial Overgrowth, and that's when bacteria begins to become overgrown in the small intestine. And you guessed it, that's sometimes linked with aging, and that's because, again, as pancreatic function declines, we may have trouble digesting our food, and then it becomes a breeding ground for bacteria in the small intestine. And finally, hormonal dysregulation. Believe it or not, as hormones decline, that also can cause challenges with our hormones. So what do we usually do in a case of somebody who's over the age of 40 and starting to have digestive upset? Well, we want to run the labs, make sure we're not looking at an infection. If they're having an H. pylori challenge, if they've got an infection, we would treat them for H. pylori. We also want to treat them if they've got a stomach ulcer. If it's SIBO, small intestinal bacterial overgrowth, then we're going to want to create a protocol for that as well. I tend to also, in patients over 40 who have IBS, I like to recommend digestive enzymes just across the board. I don't recommend hydrochloric acid if the person may have a stomach ulcer, because that can be irritating. Instead, I tend to prescribe the digestive enzymes that are plant-based until I know for sure that we're not dealing with a stomach ulcer. In terms of other support, some people have gotten success with probiotics. The best time to take a probiotic is you want to take it with food, just to make sure that the probiotic is getting ample nutrition so that it can survive in the digestive tract. Other people have said that they get good results if people take it prior to bed. I think first thing in the morning with breakfast is the best time to take it. I get also a good response from something known as the bitters. These are herbals that have been used for centuries to help stimulate saliva. This is especially helpful in people who have dry mouth and who think that some of their digestive challenges are due to dry mouth. With bitters, you can usually do 3 to 4 squirts in a little bit of water. Sip it before your meal, and that can be quite helpful. The Victorians have also traditionally used apple cider vinegar first thing in the morning to help wake up and tonify the digestion. I never recommend drinking apple cider vinegar directly. Maybe 1 or 2 tablespoons in some water, maybe with a little honey, would be the more traditional way of doing that. Okay, so this is just a quick video talking about the relationship between irritable bowel syndrome, digestive upset, and perimenopause. If you'd like to find out more about my practice, if you'd like to schedule an online appointment, you can find out more about me by going to drwhimsy.com. And if you're in the LA area, I would love to see you by having you come and check out our offices. I want to thank you for watching this video, and we'll see you next time. Take care.